Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about finding the right level of care when you need it. We'll talk first about primary care and family practice with Dr. Catherine Pechon. Next, we'll talk with Kira Smith, a nurse practitioner, and she'll explain to us two different types of mid-level care, express care and urgent care. And last, we'll talk with Rebecca, who runs our Mandeville Emergency Department. She'll talk with us about emergency care, seeking care at a certified center when you are experiencing stroke, heart attack, or trauma. And then she'll talk about pediatric care in the emergency department and freestanding emergency facilities such as the Mandeville Emergency Department. So we'll learn all about the different levels of care in the next 30 minutes on Healthy Living. We'll start first with Catherine Pechon. She's a family practitioner in St. Tammany Physicians Network's location in Madisonville. Welcome, Dr. Pechon.
Thank you. Thank you for having me.
Really excited to have you here from Madisonville. Tell us a little bit about the clinic.
So our clinic is located in Madisonville on Highway 22. We see adults, we see children ages 2 and up for acute and chronic care needs.
Okay, so if you're on 22 in Madisonville, does that put you near the elementary school?
It does. If you drive down 22, pass over the bridge, pass towards Ponchatoula, we're about 3 miles on the right.
Perfect. So whether someone is from the Madisonville area or the Ponchatoula area, you're really convenient right there on Highway 22.
We're right there.
Fantastic. Okay. And so that clinic there in Madisonville is a family practice clinic. So talk a little bit about primary care and family practice.
So primary care is your relationship with your chronic care doctor. It's that general practitioner that works with you as a child through your adult life on your preventative health care, cancer screenings, chronic care screenings, and as well as your chronic needs, and then as well as for any acute needs that come up as well, somebody that knows you and knows your medical history.
Okay, so the advantage to establishing a primary care provider then is sort of having that permanent record, if you will. So when you come in once a year, that provider is able to look back and say, okay, now last year we talked about these things, and how is this going, and how are you feeling about that?
Exactly. So it's establishing that relationship that you can build on over the years and have someone that's familiar with you and your medical needs.
Okay. And so primary care could be someone who's in internal medicine or a general practitioner. And in your case, your specialty is family practice. And so tell me what's unique and special about that.
Sure. So family medicine, we see both adults and children. I also do some GYN care, so pap smears, cervical cancer screenings, that sort of thing as well as some minor procedures in the office.
Okay, so if we have a family, let's say we've got mom who's making all those healthcare decisions for everybody in the household, she can potentially have the kids get their care at your office, herself, her partner, maybe even her parents and in-laws if she's in charge.
Exactly.
Okay, so really we literally mean family practitioner. So how long have you been at the Madisonville Clinic?
It will be a year in July.
This has been quite a year.
It has been.
Can you talk about how the pandemic has impacted your practice?
Sure. Well, I feel like a lot of patients delayed some care in terms of chronic care needs, maybe putting off that mammogram or that annual exam. And so we're starting to see, as the numbers continue to go down, more and more people feeling more comfortable about coming in and getting those chronic care needs taken care of.
Good. So for people who maybe should have had their mammogram or possibly did their annual physical back in 19, haven't been back since then, those are folks that you need to hear from now.
Absolutely, and we can get you caught up and get all of your screenings taken care of.
And relating to the pandemic, I think the biggest focus for our health system today is trying to make sure that everyone in our entire service district has the opportunity to get the vaccine, because of course we know that the vaccine is the key to getting herd immunity and getting back to normal.
Absolutely.
So can you talk a little bit as a family practitioner about your advice to patients in terms of the safety of the vaccines and what to expect from vaccines?
Absolutely. So, as far as the vaccines go, the 2 vaccines we're giving now is the Moderna and the Pfizer. And we're offering them to patients 16 and up, and there's locations that are available both in Covington, and St. Tammany is also providing pop-up clinics, so we're having them available and convenient for people in Madisonville, not every day, but a few days out of the month. And as far as the safety goes, most of my patients have tolerated the vaccine very well that have taken it. We know that it does work in terms of reducing your risk of COVID and hospitalization with COVID. So I'm promoting it to all of my patients that are eligible. And if there's any issues after the fact, having that primary care physician, you can come back in if you're concerned about potential side effects or reaction to the vaccine and be seen by somebody that knows you.
Fantastic. So it really sounds in a way that a family practice is your medical home. It's that home base for where your records are, where people know you, where you can maybe reach out with questions or concerns, and certainly to catch up those screenings and see to it that the care your family needs is being handled.
Exactly.
Can you talk a little bit about how electronic records can make that a little bit easier, particularly for a busy parent or head of household who is possibly keeping up with everybody's records?
Sure. So one of the benefits of our electronic medical record is the patient portal. So you can log on as a parent and have access to your children's chart, to your chart, and send messages to your doctors, review labs if you need to ask for a shot record, for instance, for school. All of that is accessible through the chart. And one benefit to the electronic medical record is when you go and see other St. Tammany doctors or people that share the same record is that they have access to your chart as well. So, there can really be good coordination of care between practices and providers.
Fantastic. So, as the consumer or the patient, I see my record and my family's records in my chart.
Yes.
And then from your perspective, you're looking in the Epic system, and that is all part of that same seamless record. And anyone else that you refer me to who is in the St. Tammany system or with our partner auctioneer, they're all going to be able to see that record, to see those labs or previous visits at your office, or if we've had surgery at the hospital.
Exactly. So it's all under the same chart, and it's very easy to access through the MyChart app or online. And then it's also easy for, like I said, different providers to message one another or coordinate your care so that everyone's on the same page and that everybody is seeing what needs to be seen in terms of labs or surgeries, as you said.
Fantastic. Well, so it sounds like from the electronic to the in-person, you've kind of got it covered for the family at St. Tammany Physicians Network Madisonville. Dr. Pechon, we really appreciate you coming in to talk to us about primary care and family practice.
Thank you. Thank you for having me.
Absolutely. Up next on Healthy Living, we'll be talking about another level of care. We went from family practice and primary care. We'll next talk with nurse practitioner Kira Smith. She'll explain to us about express care and about urgent care, which are options that individuals may choose when they don't necessarily need an emergency department, but their primary care is unavailable or inconvenient.